Smoking in adults. Introduction. The aim of this storyboard is to emphasize the danger of smoking to adults, children, people with mental health problem, pregnant women and second-hand and third-hand exposures. To understand every smoker's perspective and where they are coming from before assuming, it allows the smokers to be heard and not to be judged. They can easily ask for help, guidance and support on which quit aid they can use despite their determinants of health. In the UK, in 2019, 14.1% of people aged 18 years and above smoked cigarettes, which equates to around 6.9 million people in the Population Annual Population Survey, APS. Tobacco kills 8 million people each year worldwide. WHO. Learning Outcome 1. Locate, select, present, and discuss relevant health data to identify the health needs of a vulnerable group or community. According to the NHS 2018, 78,000 people in the UK die from smoking. The health risks from smoking is getting higher, from worsening current illness, causing cancer in other parts of the body, damaging heart and blood circulation, passive smoking, reduce fertility and smoking during pregnancy. In 2019, over 6 million people or 13.9% of adults in England still smoke despite the decline in smoking prevalence, gov.uk. Smoking has killed 74,600 people in England in 2019. In 2020, 506,100 hospital admission attributable to smoking, 710,000 prescription dispensed to help stop smoking, and 74,600 deaths attributable to smoking. In 2014, Preston is the leading city with score of 25.3 current smokers in adults per area in Preston district, compared to bigger cities such as London with the score of 17.0. Smoking prevalence on all English regions with scores of North East and North West with 19.9. Yorkshire and Humberside with 20.1. West Midlands of 16.9. East Midlands 18.8. East of England 17.9. South East 16.6. And Southwest 16.9. Stopping smoking will help them to live longer, wounds will heal quicker, infections to be lessened and admissions to hospital will decrease. The Department of Health and Social Care agreed that smoking became a dependent for people that smokes. Thus more healthcare system setting is being provided with the help of the NHS long-term plan for healthcare professional to discuss and give advice to smokers. Smoking decreases the life expectancy of every smokers. The Public Health of England conducted an analysis within the North West England and resulted with mental well-being being part of the reason why adults smokes. They are 2.5 times likely to smoke and 40.5% of adults with severe mental illness smokes. If a mother smokes during their pregnancy, chances are they will suffer from miscarriage, stillbirth, premature, and complications with the baby. According to the recent evidence review conducted by the Public of Health in 2018, they have found that the use nicotine replacement shows no danger to the pregnant women nor to the fetus. Learning Outcome 2. Define health and well-being and discuss perceptions of health, health literacy, social influence and behavior whilst giving regard to equality and diversity. Health is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. WHO Constitution. Well-being integrates mental health, mind, and physical health body resulting in more holistic approaches to disease prevention and health promotion. CDC. Individual perceptions of factors that affect the perception of illness and with the importance of health to the individual, perceived susceptibility, and perceived severity. Jans and Becker, 1984, Rosenstark and Strecher, 1988. Health literacy is linked to literacy and people's knowledge, motivation and competences to access and understand health information. Apply health promotion every day to improve quality of life. WHO, 2013. Social influence is the behavioral change of a person because of the perceived relationship with other people, organizations and society in general. Sun and Tang, 2011. A study from Action on Smoking and Health, ASH, 2019, suggested that age 16 plus are more likely to smoke because they live in a single-parent households, rented accommodation, few educational qualification and limited access to public transport to be able to reach community support. People based from lower income livelihood are unlikely to quit because they perceive smoking as vital part of their day-to-day lives and it is their way of coping with stress and any other mental health issues. 60% of smokers that wants to quit, only 10% intends to do quit within 3 months. According to the UK Health Security Agency, people believes that the harm from cigarette itself mainly comes from the nicotine. Hence the use of nicotine replacement therapy, NRT, and e-cigarettes are getting brushed off. Smokers perceive hand-rolled tobacco as healthier than cigarettes. However, hand-rolled tobacco may be cheaper, but it has 4,000 toxic chemicals every smoke, which is poisonous and carcinogenic, informs Scott. Tar and nicotine are higher for smokers who does not use filter. Another myth amongst smokers is second-hand smoking is not a danger to anyone. Non-smokers exposed to smokers is 20% to 30% likely to contract lung cancer or stroke, while 25% to 30% for coronary heart disease. Children that are exposed to their smoker parents are more likely to inhale more chemicals as they breathe faster than adults. From the study conducted by Putt, et al. In 2004, one of the 6 social influences was called explicit social influence, where influence around them is direct and overly passive. Connected to this study is called explicit verbal social influence, where a smoker tells another smoker to quit smoking. From this study, the difference between the influence from their environment and with the healthcare professional, the explicit verbal stimulation helped effectively than professional help. Korhonen, et al. 1989 to 1996. Health inequities are defined as systematic differences in health that can be avoided by appropriate policy intervention and that are therefore deemed to be unfair and unjust. WHO. Disadvantaged people may come across as people with less knowledge about the health hazard of using tobacco. This falls under education level. If the person had the capacity to attend school, regardless of their ethnicity background, despite being poor, they should have equal opportunities with everything. Smoking-related death rates are 2 to 3 times higher in low-income groups than in wealthier social groups. Marmot, et al. 2010. Learning Outcome 3. Discuss the determinants of health, illness and well-being and apply this to patterns of health and well-being outcomes. In relation to the World Health Organization, WHO, determinants of health include social and economic environment, physical environment, and person's individual characteristics and behaviors. Smokers are less likely to be employed at every level of educational attainment than non-smokers. ASH, 2020. In the 2018 survey, ASH, young people were asked if smoking is acceptable. 80% of children said that smokers made it look cool in front of their friends, 69% were pressured by their peers. 95% of young people regularly smoke to help cope with stress, 82% to feel relaxed and 80% because they are addicted. The Action on Smoking and Health, ASH, stated that unemployment and reduced earnings due to smoking result in £14.1 billion British pounds of lost income across the UK each year. £7.2 billion British pounds in reduced earnings to working smokers and £6.9 billion British pounds of lost earnings due to smokers being unemployed. Current smokers are 5% unlikely to be employed, which equates to 309,000 unemployed people. 9.7% of people that smokes has A levels as their highest level of attainment, 8.4% with no formal qualifications and 7.6% with GCSEs as their highest qualification. 33% of smokers are likely to call in sick, resulting of productivity loss to the UK of £1.4 billion in 2011. Landman Economics, 2020. Around 1.1 million children in the UK are living in poverty and lives with at least one parent who smokes. Tenants who smoke lose their income on tobacco by 12.4% than private renters by 8.8%, and homeowners by 8.4%. A smoker who earns the average earnings, minus the expenditure of cigarettes, roughly they spend £2,759 every year in cigarettes alone. Ash. Learning Outcome 4. Discuss the aims and principles of health promotion, protection, and improvement and how this can benefit a community to improve mental, physical, behavioral, and other health-related outcomes. Health promotion is to enable people to control and improve their health. Increase knowledge towards social and environmental interventions, WHO. Promoting health allows everyone to access help anytime they would need assistance. The government will see the problem from the statistics every city and region release and take an action on how to prevent and solve it. Understand health determinants to identify what kind of health risk is present, what help is available and what support can be done despite the living condition, education level or employability state. Health persuasion techniques. Used for government or public health expertise to help individuals redirect them to positive outlook. Use of mass media is a hugely used technique for health persuasion. Such examples are the usage of television, via advertisement, online news and articles, and social media. Legislative action for health. Employs public health authority to improve health through environmental controls, taxation, etc. Environmental controls such as clean water for everyone regardless of anyone's state, clean environment, healthy lifestyle and diet, clean housing, and clean schools for children. Personal counseling for health. Emphasizes if individuals are given opportunity to access possible help and to change and improve their lifestyle. This is an aid for people through counseling process, available via group discussions surrounded by group of peers or one-to-one with the counselor. It also focuses on life review where a person identifies the problem, examined the social situation, then leads to reflecting on how it will change their life, and moving on to the stage of acting and implementing it to positive change. Community development for health. Characterize interventions together with everyone that has the same condition to unite and take action to improve health prospects. This has been introduced for everyone, and especially for disadvantaged communities where people are united to discuss the problem and come up with a solution on how to end their concern. A health promotion worker in a community works as the voice to vocalize their needs to local health organization and welfare services, for them to gain access on any help available. The government works to help every individual to cope and address any health changes and health needs. Once the risk has been identified, finding solution will commence, and distributing it for everyone. The Public Health England has launched a guidance titled, Health Matters, Smoking and Quitting in England, with the objective of identifying the smokers' health inequalities especially from a deprived place. Assistance in reducing the cigarette intake until they start to think about quitting, and the objective of how to do it will commence. Guidance has been updated on the 5th of April, 2022, for smoking and tobacco, applying all our health. The guidance is set in an e-learning session where healthcare professional can easily access, thus encouraging people to stop smoking is to be effective soon. The objective is to increase support towards smokers. With the encouragement of healthcare professionals, smokers will have the help on identifying which kind of support is effective for them, how, where and when to access quit aids, getting help from local stop smoking services. Smoking aids such as nicotine replacement therapy, NRT, e-cigarettes, vapes, prescription tablets varenicline, Champix, Orbupropion, Zyban, and any further support. Health Matters, Stopping Smoking, What Works? Aims to focus on quitting routes and its effectiveness and how people perceive nicotine and e-cigarette safety. The objective is to aid smokers to get the best support and help for them rather than stopping without any help but their will, which is the least effective way. The aim of RCN is to produce help for healthcare professionals to encourage their patients to stop smoking. A 20-minute difference without smoking is showed. RCN introduced the National Center for Smoking Cessation and Training, NCSCT. Its aim is to increase professionals' knowledge and to improve leading skills. Very Brief Advice, VBA, is linked with NCSCT, which is to be read to the smokers. Ask all patients if they smoke. Advice, the best way to stop. Act, provide a referral or offer behavioral support and drug treatment. On March 2020, Action on Smoking and Health produced a Stopping Smoking Guide. It campaigns on what to do before quitting. ASH also emphasized to consider their money every pack of cigarettes spends. ASH also added quitting aids on what to do for their nicotine withdrawal, by following nicotine replacement therapy, NRT, and if e-cigarettes may ease the intake of tobacco. ASH also emphasized the benefit of stopping smoking. One of their campaign is called Stoptober, the 28-day smoking challenge. They encourage smokers to stop smoking for 28 days while giving them the information of benefits of stopping smoking. It emphasized what the NHS has been campaigning. The Stoptober can be followed by downloading the NHS Quit Smoking app to track their progress, how much money they save and daily support. The Public Health England Fair released a film showing the harm of smoking and how it can be avoided by following quit aid or use of e-cigarettes. The research estimates that e-cigarettes, vaping, is 95% less harmful than smoking. 2.5 million of adults are now using e-cigarettes in England. Conclusion. Smoking is still one of the leading cause of death worldwide. Smokers may want to quit, but without any help and determination, quitting is impossible. That is why campaigns, advertisement and any professional plays the big role for every smokers that needs help quitting. Quitting is not impossible if the right aid is being followed. Medication can easily be prescribed for smokers after visiting their GP. Nicotine replacement therapy and the use of e-cigarettes are one of the popular methods used to effectively stop. And lots of communities, mobile phone app and healthcare professionals are willing to spend their time to reach out to people that every piece of cigarette not to be taken will prolong their life, decrease visits from the hospital and any health ill related. Smoking is addictive. But with love and compassion for the smokers from the healthcare professional and everyone around them, if we can help one person, we can start to help everyone, and we will have a smoker-free world for the future.